Hello and welcome to the pod. I'm Nathan Fink.
I'm Jasmine Torres Allen, and this is New Hampshire Family Now,
a show about building family in the Granite State. Today in the podcast, we welcome 603 Bricks program owner Brandon LaRouche, and we reprise an interview with PCA America's Chief Strategy Officer Jennifer Jones, keynote at the Children's Trust's 12th Annual Strengthening Families Summit. Today's show was brought to you by Service Credit Union. You go beyond for your family. That's why Service Credit Union goes beyond for you. Get more for your money, reach milestones sooner, and plan for the future you've earned. Service Credit Union will support you every step of the way to go further than you ever imagined. If you're driven to go beyond, you belong with Service Credit Union. Visit servicecu.org to start your journey today. This podcast was also brought to you by Family Support New Hampshire. Family Support New Hampshire is NH's coalition of family resource centers and family strengthening programs that exist to ensure Granite State families have access to resources so both caregivers and children can succeed, because supported families are strong families. To find a family resource center near you, visit www.fsnh.org. Hello and welcome to the podcast. We have a great show for you today, including a reprised interview with Prevent Child Abuse America's Chief Strategy Officer, Jennifer Jones, who will be keynoting the Children's Trust's 12th Annual Strengthening Family Summit, taking place on October 29th at the Grapponi Center. But first, I'm thrilled to welcome a guest co-host, Brandon LaRouche, program owner at 603 Bricks, a charity organization that builds positive experiences one Lego brick at a time. Brandon, welcome to the show.
Thank you, Nate. Pleasure being here.
Just so you know, we are deep in the Ninjago mech era, I guess, which also means like every floor in our home is booby-trapped for the sockless.
That's awesome.
Now, I'm absolutely blown away by 603 Bricks. Can you describe what your organization does?
Right. Well, we get going on how it started. So during the COVID times, all the adults in the world started going back to their own hobbies when they were kids, and mine was Legos. So I started on Marketplace buying all random Lego lots and organizing them. And I had a storage unit full by the end. And I told myself, that I needed to get rid of all these. So October of 2023. So that's when the first donation was to the Boys and Girls Club of Skowhegan Valley. And that's when it all started.
So what I'm hearing then is what you do is you take in Legos, you sort them, and then you try to find homes for them in the community?
That's correct. So I get all the junk out. So there's a bunch of non-Lego bricks in there. So I make sure that it's all genuine Lego. And yeah, so I spend my time sorting all the Lego bricks.
That's amazing. Now, to be a bulk Lego buyer, you must really enjoy building Legos yourself.
Oh, I do. But I never had time to build. That was the issue. So I bought all these Lego bricks, thought I would have time to build these Legos, but they all got thrown in a storage unit.
Now, tell me then about the act of building, because when I look back at my childhood, sitting around a pile of Legos, looking, building is foundational to my childhood memories. What is it for you about building that you think is so beneficial?
So building with Legos could really change a child's mindset. It could put them in a different career direction than what they thought they were going to do. Technical, become an engineer. You could be in a trade. You could do all sorts of things once you experience building with Legos.
Yeah, I love seeing my sons actualize some sort of internal, invention. It's almost like if you're a Marvel fan, Green Lantern, if you can imagine it, you can bring it to life.
Exactly. And you could do all sorts of things educational with Legos. You could do math fractions. You could use Legos with your kids, or teachers could use them for their classes. Get the kids more involved.
Now, this is maybe a controversial question for those Lego connoisseurs out there. To sort versus not to sort your own Lego collection. I'm in the camp of not sorting just because hunting for the right piece, while it takes a ton of time, it did something to me. What's your take on that?
So you could create whatever you want with the Legos that you see in the bin if you don't want to spend time sorting through them. Yeah, I used to sort before the donation, the first donation. I used to sort by color because I had in mind that I was going to build all these different Lego sets, go back in times, go on the Lego website and just try to build as many of the 90s, early 2000s Lego sets. But yeah, I spent a lot of time going through the bins looking for one piece. If a program specifically needs one piece, because a lot of programs like libraries and stuff, they lose their bricks once they give the sets out. It's kind of like renting a book. So I have to sort those bricks out in the bin.
It does strike me that, you gave kind of the history of COVID coming back, trying to, figure out your own life situation with all these bricks in storage. But there's another layer here. And I read about this on your Facebook site, this idea of you getting back to a place that's healthier and using this as a mechanism to change your life. Talk to me about that.
Yeah, so instead of being bored and eating all these unhealthy snacks, my time is consumed by the Lego donations and sorting Legos. So going back even more personal, so I have epilepsy and I figured out my health along the way of sorting Legos and what foods affect me more.
Yeah,
it feels like everything's set in place. The whole Lego donations, this wasn't planned. So this is all just falling in place.
I'm curious to know, how many pounds of Legos have you donated thus far?
So within a year, so at the moment, 2,700 pounds of Legos donated, and I'm in the middle of sorting 300 pounds at the moment to make it 3,000 pounds, hopefully by the end of October.
Now, is this a hobby or is this a full-time career?
So this is a hobby. So I still have a full-time job. This is my office that I'm sitting in as we do this. So at the moment, I work in the dental lab field. So I help dental labs figure out how to use their dental implant machines. My employer is being really supportive. So I come in an hour before work and then during my lunch break, which is an hour. So at least 10 hours during the week. And I plan for 4 hours on Sunday. So looking at 14 hours a week at the moment. And I used to spend my whole weekend sorting Legos.
Now, if people want to get involved with this, if people either want to donate their own Legos or they want to support this project, that you call it a hobby, but this is really foundational building blocks of, I think, child development, family interaction. What can people who want to support you do?
So they could go on their community Facebook pages, start collecting Legos. I post on the Southern New Hampshire pages, mostly Western to Central, once a month. And the community has been very involved. So they surprised me. There's a lot of Legos out there just sitting, not being used, that could really be beneficial to the next generation and families. So 603 bricks with an X.
So, Brandon, seeing how you're going to be at the 12th Annual Strengthening Family Summit, is there anything we can expect from you and 603 bricks while we're there?
So I planned on bringing 300 pounds of Legos in 10 separate Lego donations. So any program that could use some Legos could pick some up, and other programs could tell me at the summit if they need a Lego. So they'll be next in line for the Lego donations.
At the moment, what would you say your favorite Lego set is and why?
So I still buy Lego sets, and I'm still very interested with how realistic they're making these cars. So the Lego Technic cars, the newer ones, and the Speed Champion sets are my favorite.
Are there any sets out there that make you shake your head?
Well, I see the pricing of the new Lego sets and how Lego is advertising for adults and not children anymore, because they realized when COVID started that all these adults were buying Lego sets. But that's another foundation on how this started, because I want kids to have a chance to use Legos.
Well, what we did for our 12th Annual Strengthening Family Summit is we wound up going and buying the Lego family tree sets in mass, as well as a series of bonsai trees from their botanical collection.
Yeah.
And we distributed them to families throughout the community with the intent that they would have a family project to build their own family tree. And so what we're doing now is recollecting those and using those for the centerpieces of our 12th Annual Strengthening Strengthening Family Summit so we can center our thinking on the work that we do and how it can help this particular family so it can produce wonderful things.
Oh, wow.
So what you're doing is right up our alley. I so appreciate this work. And thank you, Brandon, so much for coming on the show.
Hey, like you said, it's made me a healthier person. And that's just another reason why I do it. But seeing all the smiles. So even teachers, they have to spend their own funds on things in their classroom. So changing that.
All I can say is everything you're doing is awesome.
And thank you, Nate.
Everything is awesome. Everything is cool when you're part of a team.
We're going to take a quick break, but when we come back, we'll have more with Jennifer Jones, Chief Strategy Officer at Prevent Child Abuse America and keynote at the Children's Trust 12th Annual Strengthening Family Summit. Don't go anywhere. Today's show was brought to you by the Couch Family Foundation. As an organization that supports healthy children, strong families, and vibrant communities, the Couch Family Foundation is proud to sponsor the 12th Annual Strengthening Family Summit. The Couch Family Foundation is working with partners like New Hampshire Children's Trust to ensure that all New Hampshire children from birth to age 5 have access to equitable, high-quality, affordable early care and education. For more information, visit couchfoundation.org. Today's podcast was brought to you by Dartmouth Health Children's. As the only comprehensive pediatric healthcare system in the region, Dartmouth Health Children's promotes health, advances knowledge, and delivers the best patient and family-centered care for infants, children, and adolescents. Shared knowledge from expert providers across the system increases their ability to care for patients and families close to home. From annual checkups to specialized treatments, Dartmouth Health Children's is dedicated to ensuring all children live their happiest, healthiest lives. For more information, visit childrensdartmouthhealth.org. That's childrens.dartmouth-health.org. Today's show was also brought to you by NFI North. For more than 40 years, NFI North has served as an indispensable nonprofit resource for delivering mental and behavioral health care services to children, adults, seniors, and families across Maine and New Hampshire. To learn more, visit nfinorth.com. Hello and welcome back to the podcast. Today on the show, I'm thrilled to be joined by Prevent Child Abuse America Chief Strategy Officer Jennifer Jones, who not only has served as a director of many child and family serving organizations and initiatives, but also hails from the territory of Wisconsin. Wisco, if you know it's good for you. Jennifer Jones, welcome to the podcast.
Nate, so great to be here. Thank you so much. I also just wanted to say, yes, of course, we have sort of this Wisconsin connection.
We have to be careful because this is going to quickly turn into me and you talking about best Bloody Marys and where to get them.
Exactly.
So truly, thank you for coming on. I know you and PCA America team are incredibly busy, given that you've recently released, not to mention co-authored, a theory of change for primary prevention in the U.S. But before we get to that and the theory of change, help me understand what primary prevention is and why it's so important to us all.
So as you know, Nate, and I just, want to acknowledge, you can Google primary prevention and actual definitions come up, right? There are certainly definitions that people look at and seek out around what primary prevention is. But what I like to say when I talk about or sort of explain primary prevention is this idea that we need to create the conditions for all kids and families and communities to thrive. And so what does that mean? It's about addressing the social determinants of health. So we know that includes a number of things. It includes health, certainly health access, mental health. It also includes housing and transportation and poverty and systemic violence, right? And so we don't want to just prevent kids and families from coming to the attention of the child welfare system or prevent them from going into foster care. We actually want to reach families before they are in crisis. So we want to make sure they have what they need when they need it, and they can get it in the communities where they live. They can access it in the communities where they live. And so in essence, we want to ensure that all kids and families are living a purposeful and happy life with hope for the future, which is what our North Star is for our new theory of change.
I love what you're saying about this idea even of creation. The idea of creation to me suggests that there is a role for us to play in it, right? We're not passively sitting by saying, all right, if we are preventing something, we're actually creating more nurturing environments with hopes that we develop some sort of system where people thrive. So I wanted to ask this idea then, because a lot of the times we think about our families and from a bootstraps lens, like if you don't have these things, it's somehow reflective of the caregiver you are. So when we look at what environments can do, if we create them, why is that significant a perspective change for families? I
think that's a great question, Nate. And I think what our common narrative is in our country is that it's the individual behavior, right? And we even talk about that when we talk about ACEs, right? When we talk about adverse childhood experiences, it's my individual experiences and circumstances and situations. And rarely do we talk about the systems and the conditions that actually perpetuate individual ACEs. And so, Dr. Wendy Ellis did some great work, her team around the pair of ACEs, which really brought to light the fact that there are all these conditions, adverse community environments that exist for all of us. And so it compounds our individual ACEs. And so we need to go beyond. And I think our prevention field is getting there, but it's taken us a while. We need to go beyond thinking about just parenting classes or individualized interventions and programs. What are the systemic factors and the conditions that people live, work, play, and pray in every day that are contributing to whether you're well or not? And so this idea of, and I know we'll get there, but this idea of this ecosystem is really about how do we address those systemic conditions so that we're not just preventing those individual ACEs, right? We're not just preventing ACEs, but we're actually promoting health and wellness and happiness and positive childhood experiences and all the things that we know are critical to making sure that families are safe, kids are safe, and they have the financial stability and economic mobility that we all need and that we all know is really important to us being, creating safe, stable, nurturing relationships and environments. So I think it's really, we need to go beyond the individual. It's important, right? We know that programs and services and interventions are critical and a component of this ecosystem, but we really need to start addressing those systemic issues if we really want to make true, meaningful, authentic change in our country.
Now, there certainly, though, has to be a nowness to this issue for you as an organization and as an individual to really write yourself into it with a theory of change. Why did it become necessary to envision primary prevention efforts as existing in that larger ecosystem so to support individuals and family?
Yeah. And so, as you know, Nate, and I obviously just mentioned this, but as part of our new theory of change, we call for building out a comprehensive and aligned primary prevention ecosystem in this country. We believe it does not exist. There are certainly components of it in certain places, as I'm sure there are in New Hampshire, there are here in Wisconsin, they exist in places, but they're not comprehensive and it's not aligned. And so we believe that in order to address these systemic conditions that we've been talking about, we need this comprehensive primary prevention ecosystem that includes a diverse array of actors working in this collective manner. We talked about this idea around collective responsibility with a shared sense of urgency. And so the research shows that all 7 of these levers must be present in this ecosystem if we're going to achieve our aspirational outcomes and ultimately our North Star. And so these include things like shifting mindsets, right? Having policies and practices in place that support positive and equitable childhoods for all kids. And then the idea, which we talked about, the idea of family supports and programs and services and interventions, right? It's those things like home visiting and family resource centers that are accessible. People can get them wherever they live. But if you notice, it's not just that. And I think that's where we spent a lot of our time the past 50 years of our work in the primary prevention field, and really, building up these programs and interventions. But if we're going to see, again, this change that we all want to see in this country, especially for kids and families, we need to do things like shifting mindsets, right? We need to transform the narrative around prevention. If we do that, we're going to see change. We're going to see change in policies. We're going to see change in practices. We're going to see changes in environments. But it's critical that we have all 7 of these pieces as part of this ecosystem. I want to just call out too, Nate, you, when we were talking at a meeting, I don't know, a couple of weeks ago, maybe a month ago, you actually brought up this idea of an ecosystem when you said, and I'm going to quote it, I have it here, an ecosystem is typically described as healthy when the organisms living in it are diverse, many, and stable, and the system as a whole is able to withstand and adapt to shocks and changes over time. That resonates, right? I think that description of what we're trying to build really resonates. It resonated with us when you said it. I think it resonates with others in our field and our partners. But it's that idea that if we create this ecosystem that is healthy, that all of us are contributing to in a collective way, again, with this sense of urgency, that we can withstand anything that comes at us, right? And that includes environmental issues, that includes violence, that includes poverty, right? That this ecosystem is capable and prepared and has the tools and the resources that they need, that they can adapt to these shocks and changes over time. And that's what we need for kids and families in our country.
Yeah. I'm so glad you said that, and especially ended with this idea of kids and families, because throughout the framework, you go to great lengths to make sure you're placing families squarely in the center of really everything you're doing. Now, why is that fact, the centering of families, so critical to the success of all the ecosystem work we're trying to do?
Yeah. So a little bit of context that I think that I'd love to share here, because I think it's important, is so we used an adaptive strategy process to create the theory of change. We were very intentional about the process. As part of the process, we engaged nearly 1,700 people across the country over the 2 years that we were working on this. And that included parents and families, right? It was critical for us and really important to ensure that the process really raised up the voices of families. And so we talked to parents and families. We talked to our Healthy Families America sites. We talked to you and others in our state chapter network and our key partners. And again, it was so grounded in the importance and critical nature of ensuring voices of families and voices of our key partners, grounded in research, and we wanted it to be adaptive and flexible. Again, this idea of the ecosystem that we can adapt to things as they come at us. And so as we create this primary prevention ecosystem, we believe it's absolutely critical to center families in decision making. So we are building an ecosystem that is responsive and reacting to what we know families need, to what families are telling us they need in order to be healthy, happy, and well. You look at companies like Apple and Google, for example, right? They don't create anything without this end user in mind. They go out, and I've participated in a couple of these trials, right? Where research projects where they're seeking input and feedback from the end user. We don't do that in our field. They do it every time they create something. So it's part of their culture, right? It's part of their narrative. And we need to make sure that not only are we seeking input and feedback, but that families are actively engaged in the co-creation and in the decision-making throughout the entire process, so that it's actually part of our organizational DNA. And that is going to create an ecosystem that will be successful, that will be responsive, and that will be adaptive to families' needs and wants.
That reminds me of a story a good friend who's an architect told me around human-centered design. He was saying, if you want to design a park that has a system of walkways through it, plant grass, and then 2 years later, pave over where the trails are. That's human-centered design, right? But he also said that's a nightmare for architects because they want to control behavior.
That's a great example. And it is because we do this all the time in systems, right? We assume that we know what is best for families.
Right.
And when we, instead of saying, okay, you come into the child welfare system and we're going to give you parenting classes. Instead of just automatically assuming that they need parenting classes, why not ask families what they need? And oftentimes we find, and this is based on the research and surveys and feedback, that what they need is financial support, right? They need stability. They need economic mobility. And so we should be responsive to that. And we should be creating interventions and programs that respond to that, as opposed to thinking we know what's best and we give folks what they do not need.
Yeah. You and I talk about this all the time. When you give families what they need, good things happen.
And we know this, Nate, that families know what they need, right? And they know best what they need. You know what's best for your family. I don't know what your family needs, and the same, right? And so engaging families and caregivers in the conversation, in the design of what it is we want to create, and especially this idea of an ecosystem, is absolutely essential to, and will show and prove whether or not we can be successful if we're successful in co-creation and co-design.
Now, there's a lot of buzz around the theory of change here in New Hampshire, and I know in other states as well. So if I'm another organization or stakeholder, and I want to get involved, how should a family supporting agency approach understanding and even implementing a document like the theory of change?
Yeah. And so thank you for that question. We, as you know, Nate, because you were there, we announced our theory of change at our national conference. Melissa Merrick, our president and CEO, announced it in our opening address in Baltimore last August. We had a sold out crowd. There were over 1,200 people. It created a lot of buzz and excitement. And there continues to be great momentum around this work across the country. And so we're hearing things like, for the first time, it finally feels like we have something that we can collectively embrace and we can all rally behind. And so it became pretty clear throughout our process, throughout the adaptive strategy process over the last 2 years, that the value of this theory of change is not just about PCA America, right? So when we embarked on this initially, we were creating a theory of change for Prevent Child Abuse America. And it became pretty clear early on that this is about a primary prevention framework for the entire country. Like, our contribution to the field is this idea of an ecosystem, this idea that we can achieve these aspirational outcomes and this North Star if we all collectively unite and work towards it. And so we created this plug and play theory of change where anyone in our network or any one of our partners can insert their strategies and their values and beliefs, and it will all align. Their efforts will all align up to our shared work to build this comprehensive primary prevention ecosystem and obviously achieve the shared outcomes. We see this among the state chapters. How does New Hampshire's work or Colorado's work or Virginia's work or Oregon's work? What are the strategies that they need to employ in order to build this ecosystem? And so we have this plug and play theory of change, but we also have a number of tools and templates that we're building out to really help folks, our state chapters and others who are really interested in becoming part of this movement. People can go to our website. They can contact me. They could probably contact you, Nate, because you are doing some great work there in New Hampshire. So really anyone can participate in this, in helping to achieve our aspirational outcomes and our North Star.
Now, if listeners want to hear more about the work, what you do, where can they go?
So as I mentioned, Nate, anyone who is interested in our theory of change, they can download the full document on our website. It also includes the plug and play theory of change template, and we will continue to upload tools and templates. They can reach out to me and other staff of Prevent Child Abuse America. Certainly, as I mentioned, they can reach out to our state chapters as well. But I also want to just, call out, Nate, the incredible work that you all did in your 2024 resource guide for New Hampshire. I think you did an incredible job really talking about the ecosystem in the context of what it looks like in New Hampshire, how it's being implemented, what are things that, you all need to think about in your work. So folks can come to us, but more importantly, they can go to you, and in particular, go to your resource guide, because there's some just incredible information and insight in there about how this work applies to the great work that you're doing in New Hampshire.
Well, I appreciate that. We certainly couldn't have done it without you, your hard work, your research, and your wonderful theory of change. Jennifer Jones, it's been incredible. Thank you so much for coming on the show.
Nate, thank you so much for having me. Thank you for your leadership and your thought partnership. Obviously, the New Hampshire Children's Trust are critical partners in helping to ensure the success of this theory of change and ultimately eliminating child abuse and neglect in this country, which is where we want to be. I will just end by saying I truly believe that this is our moment in history. I think it's our moment in our field where we can finally achieve the aspirational outcomes that we all have long desired for kids and families in our country. And so we're incredibly excited to be part of this journey, to be thought partners and colleagues in this work, to work closely with you and other state chapters and other key partners to make it happen.
And many thanks to the Office of Social and Emotional Wellness, or OSEW, at the NH Department of Education for sponsoring this podcast. OSEW's mission is to advance youth social emotional wellness by collaborating with federal, state, community, and family partners to implement evidence-based, data-driven, preventative, and responsive approaches to lifelong social emotional skills for New Hampshire's students. To learn more about the Department of Education, visit www.education.nh.gov. Today's show was also brought to you by Northeast Delta Dental. At Northeast Delta Dental, we love to see people smile. And as the leading provider of quality dental coverage for Maine, New Hampshire, and Vermont, we're committed to helping entire communities smile. Whether it's through education, supporting our veterans, or giving and volunteering, we are helping make our communities even stronger. Learn more about Northeast Delta Dental at nedelta.com. We think you'll find a lot to smile about. New Hampshire Family Now is listed on Apple Podcasts, Spotify, Google Podcasts, Amazon Music, Stitcher, iHeartRadio, and more. Listen wherever you get your podcasts or ask your smart speaker to play New Hampshire Family Now.